Hello there, this is Sandy from We Are Talk of Thailand, and today is Monday the 12th of April 2021. Tomorrow is number 13, which is Songkran, the Thai New Year. And as most people know, Thailand are going through a pretty bad time at the moment with a resurgence of COVID-19. In big style, bigger than they've ever had it in Thailand before, and it seems like Thailand's not quite prepared for it, and it couldn't have come at a worse time actually, because people have dispersed from even the hot spots up into the country to see their families for New Year. So they're expecting after this week bigger problems to emerge, and I think that's a fair assumption actually. So people like myself, who are quite elderly, and in fact everyone really, needs to be worried about what's going to happen to them here. And it's brought forward a video that I meant to do about health insurance here in Thailand, and also COVID insurance here in Thailand. And I've got some good news and I've got some not so good news. So if you want to know about it, please keep watching and I'll tell you that. Okay, let's get over the bad news first. I've been doing some research on health insurance, something which concerns us all actually as we're getting on. And obviously the insurance companies, are quite well aware that older people like myself and others that are retired here are a major health risk as far as insurances are concerned. And if you go for to buy health insurance, then you're going to pay a premium because of your age. And I've been checking on some of these, and I'll give you an idea of what you can expect and what you will have to pay. Of course, these are only an idea, and these quotes I have are based on no existing conditions. And I think it's fair to say that the majority of people that are getting into the 60s and 70s are going to have some sort of pre-existing conditions. So the premiums will need to be adjusted as necessary to take those into consideration. Either that or any problems arising from these existing conditions will not be covered by the insurance. So here's what I found out anyway. Okay, to get an idea on the insurances, I've looked at various age groups. I've looked at people aged 55. I know the retirement here in Thailand is 50, but I've started at 55. I've looked at the age group of 60. I've looked at the age group of 65. I've looked at the age group of 70. And I've looked at the age group of above 75. And above 75 is a particular problem because a lot of companies won't provide insurance once you're over 75 here in Thailand. But there are companies who will, but once again, you have to pay a premium. So the sort of cover I've been looking for is kind of minimal. What you can get. Excuse me a minute. Okay, it's kind of minimal. I have to say that the majority of people that I know that have required medical treatment, for instance, if they've gone into hospital and they've required heart surgery, they have been required to put up figures like 700,000 bahts, which is a lot of money in advance before they'll even look at them in the hospital. And then if it's more than that, then they'll have to pay it afterwards, and if it's less than that, then they'll get an amount back when they've finished their surgery. And that's quite common. $500,000's more than common actually for whatever happens. If you have a major motorbike accident or you have a major problem, they're going to want 300,000, 500,000, or even up to 700,000, maybe more, I don't know. But when you think for rule of thumb, that 40,000 is a is 1,000 UK pounds. you know, you compare how the euro will be slightly more than that batch wise to 1,000 euros, and UK dollars, well, there will be even more dollars still. So let's work on the UK pounds. I'm sure you'll be able to convert that if you want. At 40,000 bahts to 1,000 pounds. So if we look at 700,000, talking about 15, 16, 17,000 pounds you've got to put up front before the hospital even look at you. That's, to me, that's frightening actually. And even if it's $500,000, you're looking at 12,000, about 13,000 pounds you've got to put up front before you can even take your bed in the hospital for your treatment. So there is some assistance available, like my bank card, that covers me for a certain amount, but not a horrific amount, but I think it's up to 200,000 or something like that. They'll guarantee if I'm hospitalised, but I pay for my bank card, of course. But it's worth it. So what I've looked at is those age groups: 55, 60, 65, 70, and above 75. And the cover I've been looking at is 780,000 bahts, and that is with a deductible. The deductible is amount you have to pay up front if you go into the hospital before the insurance even kicks in. So for the 780,000 bahts, you will have to pay 300,000 bahts up front before you even go into hospital. So that's about £7,500 you're going to have to pay anyway, even if you have the insurance. And you have to pay that up, and that gets used before the insurance will pay anything. Then I've looked at the various possibilities where you don't pay any deductible up front, and of course the money that you're insured for per condition this is much less. So let's look at the first example: 780,000, and you're paying 300,000 bahts up front. What you would actually be paying monthly. I've done this in a monthly application, but I'm sure if you're paying annually there'll be a small discount, but many people might like to pay this monthly. So if you're 55, you'll be paying 917 bahts a month. Now that's about £22, £23, somewhere around there. If you're 60, you'll be paying 1,053 bahts, so that's about £26 a month. If you're 65, you're paying 1,257 bahts a month, which is £16 just over a month. And if you're 70, you'll be paying 1,733 bahts a month. So that's 70. It's about £35 a month, say. And if you're 78, or if you're over 75, I think it's 3,000 and something a month. I haven't actually got the figure here. I should have. Let me just check. Oh yes, I have. It's 3,466 bahts a month. Now that's about £95 a month you pay for that. So that's if you're going to pay 300,000 bahts up front to get your medical, your medication, or your whatever you need in doing. And this is only for hospitalisation actually. It doesn't cover a lot of things. It doesn't cover outpatients and it doesn't cover visits to the doctor or anything like that. This is just for hospitalisation. And as a matter of interest, hospitalisation and all your insurance policies actually, once you've taken your insurance policy out, you hope nothing happens to you for at least 30 days because barring accidents apparently, if you have a condition within a heart attack, etc., within that first 30 days, then it's down to you to pay whatever. The insurance policy doesn't really kick in till after 30 days. So that's that one, and as you can see, it's still a worrying aspect. So let's go for the zero deductible. So if you go into the hospital, you won't have to pay anything towards the treatment before the insurance starts to kick in and make their payment towards what you're going to have done in the hospitalisation. So the first example I've used is 200,000 bahts. That's the maximum cover, and you're paying no deductible, but at 55 you will be paying 978 bahts a month, which is close to £25 a month. At 60 you'll be paying you're paying 1181 bahts a month, which is close to £30 a month. At 65 you're paying 1800 bahts a month, which is at 10-15 about £17 a month. Sorry, that's about £37 a month. And if you're 70, it's up to 1,733 bahts a month. And if you're over 75, you're going to be paying 4,022 bahts a month. That's just over £100 a month for that. Now, I would comment in saying that to do this, okay, the insurance is going to kick in immediately, and they will pay up to 200,000 bahts for whatever you're in the hospitalisation for. However, bear in mind, if the hospital are going to do some major surgery and they think it's going to exceed your 200,000 bahts, then they're going to want a deposit, and say they want a $500,000 deposit. Well, they'll probably take the factor of 200,000 off of that because they know that's guaranteed by the insurance company. You're still going to be needing 300,000 to put up in front of the hospital just to start your treatment in there. And if it's major heart surgery, then that could be a $500,000 you've got to put up. A lot of money. So the next instance I looked at was 300,000 bahts donation with a zero to be paid deductible by yourself. And for 300,000, the 55s pay 1,070, which is £27 a month. The 60-year-old pay 1,300 bahts a month, which once again is £33.50 a month. Is that right? No, 25, 27, £28 a month, say. 65, you're paying 1,822, which is £36 a month. These are approximations, you have to work it out yourself. And then the concern is that if you're 70 or you're 70 over 75, then this option isn't available for you anymore. You're stuck where you are with the insurance companies that I've looked at, which are several actually. So that was 300,000. Once again, bear in mind that you're going to have to meet whatever the hospital requires before you start getting treatment. So if it's $500,000, then you're going to have to put 200,000. If it's 700,000, you're going to put 400,000. A lot of figures, but it's all big money that's of concern. So then we go into a bit deeper, and we're looking at 1 million bahts. Now then, that's a different story altogether, because if you've got insurance for 1 million bahts, I cannot imagine the hospitals will want any sort of donation from yourselves. So at 55 for a million bahts with no deductible from yourself, the 55-year-old is paying just under £100 a month, 3,758. The 60-year-old is paying 4,375, which is about £110, say. The 65-year-old is paying 6,631. That's about 160 quid. And of course, 70 and 75, forget it. And that's for a million bahts. And finally, I'll just go into 1.5 million bahts, which should cover you for anything. And I think these policies actually, also the million bahts and the 1.5 million bahts, can cover repatriation as well if required. So that's a positive aspect to these, although the monthly payments are expensive. So for 1.5 million bahts, the 55-year-old will be paying 3,986 bahts a month. That's £100 a month. The 60-year-old will be paying about £125 a month, 4,891 bahts. The 65-year-old will be paying 6,631, which is coming up for towards £200 anyway. And I've still got 70 and 75, once again, not available. Now, these are just guidelines to help you see what insurance is likely to cost you here in Thailand. And it's the medical system is good, the private hospitals are good, they're well equipped, there's good doctors, etc. But it's expensive, it's very, very expensive. Now, what is of concern right now, and when we come back to the story of the COVID pandemic and what's happening here in Thailand just now, which is very, very serious, there are already reports available where Thai citizens are being turned with COVID, that have developed COVID, are being turned away by hospitals because they've got no money to pay the hospitals. And this is even the government hospitals. They're saying, if you've got no money, then we can't admit you, you know. The hospitals are already looking like they're being overrun. And a lot of Thai citizens who've got no money have been told to stay at home. The hospitals really aren't interested in them. And certainly if you're someone like myself, a Farang retired here, then you've got no chance of any hospital treatment whatsoever unless you've got funds in the bank or you've got a good insurance policy to support you. Now that's a major concern to the majority of us expats that are living here in Thailand, actually. So that's bad news. Okay, not to rattle on much longer, let me give you some good news. That this morning I found a company that is offering COVID-only insurance, and there isn't many of them actually. And I managed this morning to take out a 1 million baht I'm talking rubbish, sorry. I managed to take out a 100,000 baht COVID coverage for just 450 bahts with no deductible. So if I catch COVID in 15 days time, because there's a 14-day quarantine, there's a 14-day no insurance period, but if I catch it in 15 days time, which I hope I don't, by the way, I'm not ready for this yet, they will pay up to 100,000 bahts of my hospitalization. So that's better than nothing anyway, plus what I've got on my bank card. I think it would probably help a long way anyway. But nothing beats trying to avoid and taking all the necessary precautions, of course, to avoid the COVID. So the name of the company that I am, let me just check my computer here. The name of the company that I got the COVID insurance from here in Thailand is Roojai, ROOJAI.com. So if you're interested in getting it, get online, check out roojai.com, and get your policy in place as soon as you can, because you don't know if and when you're going to need it. So that is really all I've got to say on the insurance aspects. Everyone's needing to be careful for sure. You know, you can see in Europe and the UK, many people thought, we are being careful, we're never going to get it. We know the people we're mingling with, etc. So how can we get contaminated? And look how many's dead now. Like I was just discussing with my wife, who's off to some housewarming at the moment, that my main worry is my 4-year-old, later this month to be 5-year-old daughter. Now she's a real little socialite, she loves running around with children, etc. And although I repeatedly tell her to wear a mask and etc., social distancing of her is down to me and her mother to make sure we try to implement it as much as possible, because she is our biggest risk factor actually. She'll go and talk to anybody, etc. And if she catches the COVID and brings it home here, then it could be curtains for me, on, or at least some serious consequences for me, and that's of concern. And I don't have a lot of control over that actually. My daughter's not going to be happy with the curtailment that we're going to have to put us through, but hopefully she'll learn to live with it, and I think she's clever enough to understand why and support us in this effort to avoid the COVID. So that's it. That's the end of my video. Please be aware of the COVID factor. If you're here in Thailand, or if you're thinking of coming to Thailand, or no matter where you are, COVID is a horrible disease. We don't have the vaccination program going properly here in Thailand yet. Hopefully that's coming soon. The news is saying that the private hospitals are ordering up their own supplies of AstraZeneca vaccine, etc. But we don't know when that's going to arrive, and as soon as we do, then me for one anyway, I'll be at the first hospital I can go to. Whatever I need to pay, I will pay to have that vaccine done. They've been talking about between 3,000 and 4,000 bahts, which is up to £100 for the vaccine. Well, if that's what it is, that's what it is, and that's what we'll pay. So, I won't ramble on any longer. Take care, and thanks for watching. Bye for now.